You already know that the silkworm proteolytic enzyme serrapeptase is unrivaled in its anti-inflammatory abilities. So today I'm going to detail how serrapeptase fights inflammation, and the best way to begin is first to understand the anatomy of physical pain. Inflammation as a response to potentially harmful stimuli like tissue damage, infection, or toxic exposure involves the activation of immune cells and the release of various chemical messengers like tachykinins, a class of neuropeptides or nerve proteins found in nerve endings throughout the skin, mucosa, and viscera, where they act as potent mediators of vasodilation, increased vascular permeability, inflammatory cell recruitment, smooth muscle contraction, bronchoconstriction, and also the transmission of pain. While there are many tachykinins, the most well-known is substance P, a neuropeptide released from sensory nerve endings and broadly present in nerve fibers. Substance P mediates interactions between neurons and immune cells, and certain immune cells like macrophages can even release substance P as part of the immune response. While substance P and other tachykinins are an essential component of the immune system, overproduction of tachykinins stemming from runaway inflammation is associated with numerous inflammatory conditions like asthma, chronic obstructive pulmonary disorder, irritable bowel disease, and even cancer, accompanied by stress, depression, and anxiety that all worsen the severity and progression of the disease. One approach towards reducing this overproduction of tachykinins is to degrade tachykinin proteins like substance P. And this is where serrapeptase comes in, because this unparalleled enzyme, which is found in the intestinal lining of the Japanese silkworm, can break down substance P and related tachykinins, along with fellow inflammatory agents C-reactive protein and myeloperoxidase. And none of this should be surprising, because serrapeptase is well known as an extremely versatile enzyme that targets undigested protein, excess mucus, and also the fibrin tangles that distinguish blood clots. The way that serrapeptase fights physical pain is tied directly to the enzyme's catabolism of substance P, which otherwise initiates a process called nociception, which is the nerve's recognition of tissue damage, which, most of the time, results in physical pain. So by breaking down substance P and also reducing the related inflammatory cascade, serrapeptase reduces pain and blocks the onset of chronic inflammation, thus allowing for improved microcirculation and better wound healing overall. As a therapeutic enzyme, you need to take serrapeptase on an empty stomach, which can be anywhere from 2 hours after a meal or 1 hour before, and you can also pair your serrapeptase with other proteolytic enzymes like nattokinase and protease for an even stronger effect. I've told you before about how minerals enhance enzymatic activity, and this is certainly true with serrapeptase, specifically regarding zinc and manganese. So when you do eat a meal, try incorporating these two trace minerals into your daily regimen. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.